So, Gigi, after we successfully treated your hip, you came back to see me again, but this time it was for your back. Why did you choose to come back to LifeStem instead of looking somewhere else?
Well, because of the success I had with you healing my hip, I knew that regenerative medicine would be before any orthopedic doctor visit. Considering Dr. Adams didn't just treat my pain, she took the time to determine the root cause of the pain.
So, share with us what was happening with your back before we started treatment.
I think it's important to know that I had scoliosis surgery in 1997 and I have two 13-inch Harrington rods attached to my spinal cord. My life involves that I take very good care of the free discs I have in my lumbar. So when I was having chronic lower back pain, I knew I must see Dr. Adams.
And what treatments had you already tried?
Hmm. I had seen a massage therapist, acupuncturist, and a physical therapist, as well as turned to my Advil Tylenol cocktail.
And what was different about your evaluation here?
What impressed me was that Dr. Adams didn't just take a look at my MRI and recommend a treatment. She explained how the spine functions as a unit and that pain doesn't always come from the disc itself. She carefully examined me, reviewed my imaging with me, and showed me that supporting structures in my lower spine were likely contributing to my pain. For the first time, I felt like someone was treating the cause instead of just the symptoms.
So, we treated your L4-5 and L5S1 functional spinal units with platelet rich plasma. Tell us what that experience was like.
Wow, the procedure was easier than a root canal or a filling in a tooth. Everything was explained beforehand. I felt comfortable throughout the process, and recovery wasn't immediate, but I understood healing takes time. But I gradually noticed that I was able to return to my normal activities pain-free.
And how are you doing today?
Well, it's been 18 months and I've had no issues. I can stand, walk, travel, and enjoy my life without constant pain that used to limit me.
What would you tell someone who's considering regenerative medicine for their back pain?
I tell them not to assume surgery is their only option. Find someone who takes time to determine the root cause of your pain. I appreciated that there was never pressure, just honest answers, education, and thoughtful treatment plan. For me, PRP has truly been life-changing.
One of the biggest misconceptions about low back pain is that it's always caused by a damaged disc. In reality, the spine functions as an integrated system of discs, joints, ligaments, tendons, and muscles that work together to provide stability. At LifeStem, our goal is to identify which of those structures is actually responsible for your pain, and then we precisely treat them using image-guided orthobiologic procedures. So every patient is different, but Gigi's story is a wonderful example of what's possible when the right diagnosis meets the right treatment. Thank you for sharing your story, Gigi. It's been a privilege helping you stay active through three very different orthopedic problems, and I'm honored that you've trusted LifeStem every step of the way.
Thank you as well.